Non-Palpable Contraceptive Implant Removal, Part 2. Removing the implant. In Part 1, we located and marked a non-palpable contraceptive implant. This video, Part 2, will show how to remove that non-palpable implant, as well as an implant below the fascia and a 2-rod implant. Explain the procedure to the woman, then gather your sterile instruments and supplies. Modified vasectomy clamps, a scalpel with a number 11 pointed blade, curved mosquito forceps, straight forceps, sharp dissecting scissors, retractors if available, gauze squares, a small metal ball, a syringe with a 25 gauge 1.5 inch needle, bandage materials, a drape with an opening if available, and 2 packs of sterile gloves. Have antiseptic such as betadine, local anesthetic such as lidocaine 1%, preferably with epinephrine, and ultrasound gel. Pour your antiseptic. Wipe off the ultrasound gel. Then clean your hands and put on sterile gloves. Apply antiseptic to the incision site. Next, draw up 1 to 2 milliliters of lidocaine. When the betadine is dry, place your drape. Then inject the anesthetic at the incision site. Check that the site is numb. Then start with a 2 to 3 milliliter stab incision parallel to and directly above the implant. Enlarge the incision if needed. With the tips of the mosquito forceps, enter the incision. Then open and close the forceps while pressing downward to bluntly dissect the tissue to the depth of the rod. Now, insert the vasectomy forceps into the incision. Move the forceps gently within the tissue, seeking the rod. It will feel like a firm object. If you are having difficulty finding the rod, use ultrasound to guide you. Put a sterile glove or condom on the probe. Add gel inside the glove as well as outside. Hold the probe close to the site. Again, feel for the implant. Seeing the movement of the rod confirms you have found it. Now, open the vasectomy forceps and try to grasp it. Then, bring the rod to the surface. Remove the fibrous tissue coating the rod by wiping with gauze. Then, carefully scraping it with the blade. Using curved forceps, grasp the rod. Then pull it out. Show the implant to the woman. Then measure it to confirm the whole rod has been removed. A single rod implant is 4 centimeters long. If the implant is below the fascia, extend the incision to about 1 to 2 centimeters. Then, with mosquito forceps, bluntly dissect to the level of the fascia. Use retractors to keep the incision open. Using sharp scissors, open up the fascia. You may now be able to see the implant. Using vasectomy forceps, grasp the implant. Remove the fibrous tissue. Grasp the rod and pull it out. Then close the incision in 1 or 2 layers. To remove a 2-rod implant, locate the rods with ultrasound or with X-ray. Then mark the incision site between the 2 rods and 1/3 up from the end of the rods. Inject lidocaine at the incision site and at the depth of the rods. Make a small stab incision at the mark. Bluntly dissect the tissue to the depth of the rods. Insert the vasectomy forceps through the incision in the direction of the first rod. Use your other finger to hold the rod in place. When you find it, open the forceps, grasp the rod and pull it slowly towards the incision. Remove the fibrous coating. Grasp the rod and pull it out. Use the same procedure for the second rod. After the implant is removed, close the incision with a bandage, cover with a gauze square, then wrap the arm with a gauze dressing. Remind the woman that she is no longer protected from pregnancy, and if desired, she should use another method as soon as possible. Advise her to keep the site clean and dry for 2 days. Remember, inject local anesthetic at the incision site. Make a small incision and open it with forceps. Use vasectomy forceps to find and grasp the implant.